ketogenic diet can absolutely kill you. This is Stephen Loam, lifestyle medicine cardiologist, and in this video I'm going to tell you that the ketogenic diet can absolutely kill you. We're going to go through what the ketogenic diet is, the science behind the risks that the ketogenic diet has, and then what you should be doing really to get yourself healthy, lose weight, and live a long, healthy life. Yes, the ketogenic diet kills. But before we get into those details, make sure you subscribe to my channel and turn on those notifications so you don't miss any of my future videos. Do that right now. All right, let's go. The ketogenic diet can increase the risk of heart attack, increase the risk of stroke, and increase the risk of many different types of cancers. So what is a ketogenic diet? Well, it's a diet that's really low in carbohydrates, about 5 to 10% of calories, that is higher in protein, about 20 to 25% of calories from protein, and very high in fat, about 70 to 80% of calories from fat. Things like fruit are completely avoided. Same with potatoes, beer, rice, bread, sugar. All the high carbohydrate foods are completely excluded. This puts you into a state of ketosis where your fuel for your body is changed away from glucose over to ketones. Same thing that happens when somebody is starving. Now let's see what some of the major authorities have to say about the ketogenic diet. Let's start with the U.S. News and World Report rankings. Drum roll, please. '24th out of 24, dead last in regards to overall diets for heart health. And of course, heart disease is the most important thing. Heart disease has been the #1 cause of death in the United States every single year since 1919. They say who should not try the ketogenic diet? How about pregnant women, children without epilepsy, people with certain types of cancer, people with heart disease, high-performing athletes shouldn't try this diet. Health risks are very significant. Brain fog, mood swings, constipation, high cholesterol, which could cause heart attack, stroke, and death, kidney problems, liver problems, nutrient deficiencies. Mayo Clinic's verdict, very big concerns for long-term heart health. According to Harvard, this comes with serious risk, not to mention raccoon eyes. Who wants those? The American Institute for Cancer Research says no cancer organizations recommend the ketogenic diet for cancer patients with cancer or for prevention of cancer. And just the opposite. The American Cancer Society recommends a diet with a variety of vegetables, dark green vegetables, red, orange, fiber-rich beans and peas and lentils, fruits, especially whole fruits, in a variety of colors, and whole grains. That's like the opposite of the ketogenic diet. You know, anytime a diet tells you you can't eat an apple, you know there's something wrong. An apple a day keeps a doctor away. And if you eat only one apple, guess what? You're no longer on the ketogenic diet. Too many carbs. To understand how the ketogenic diet ends up increasing heart disease and stroke risk, first we got to understand how you can clog your arteries, how atherosclerosis works. LDL cholesterol is one of the most important things. If your LDL is high, your cholesterol is high, you can clog your arteries more. The other thing is your arterial endothelium, the lining of your arteries. If it gets damaged and inflamed, cholesterol can build up there. And look at all these gray boxes at the top. Genetic determinants of arterial wall biology, high blood pressure, inflammation, smoking, and other things like diabetes can damage that artery lining. Then the LDL gets sucked up in there, starts to accumulate, gets oxidized, sucked up by these macrophages, which form these foam cells. Then the plaque progresses. Now, it can go one of two ways. On the right, it could be a stable plaque, or it can go and become a soft, unstable plaque, which leads to a heart attack or a stroke. Absolute key to heart disease prevention and even reversal is getting those cholesterol numbers down and protecting your arteries from damage and inflammation, protecting the endothelial lining at all costs. So what in your diet raises your blood cholesterol numbers? What raises your LDL cholesterol? Eating cholesterol, eating saturated fats, and eating trans fats. Those three things. And this is why the dietary guidelines say straight out that individuals should eat as little cholesterol as possible while consuming a healthy eating pattern. Cholesterol is not an essential nutrient. You don't need to eat any. Every cell in your body can make its own cholesterol. And saturated fats really increase your LDL cholesterol too. These tend to come from high-fat, animal-based foods, meat, eggs, dairy, seafood, all those things. And yes, when you look at clogging of arteries, it looks like cheese. And if any of those saturated fat conspiracy theorists ever say to you, oh, saturated fat doesn't matter, don't worry about it. Don't worry about that at all. Check out this white paper by the True Health Initiative. Walter Willett, a Harvard nutrition expert, David Katz from Yale, they put together this great document really showing how important it is to avoid saturated fat and how it leads to heart disease risk. And this is backed up by a statement from the Institute of Medicine, also known as the National Academy of Medicine, saying that they did not set a limit for how much cholesterol you could eat, how much saturated fat you could eat, or how much trans fats you could eat, because any amount that you eat above 0% of your energy is going to increase your LDL cholesterol numbers. Any amount. And you want to keep your LDL cholesterol crazy low if you can. Check out this publication from the Journal of the American College of Cardiology, which explains it really well. So here's the main graph from the study. Follow me here. On the right, we have the cumulative risk of having a heart attack. On the bottom, we have your age. And on the left, we have your cumulative LDL exposure. So the average American's LDL cholesterol is 125. And if you stay that way for your whole life, by the age of 40, you'll have a 1% risk of a heart attack. By the age of 60, a 4% risk. And by the age of 80, a 16% risk of a heart attack. Now, I see a lot of patients who have LDL cholesterols way higher than that. Say it was 160. By the age of 40, then you'd have a 3% risk. By the age of 60, a 16% risk. And by the age of 80, you're off the charts, around a 50% risk of having had a heart attack. And if you had your LDL cholesterol nice and low, say around 60, look at this. By the age of 40, way under 1%. By the age of 60, still way under 1%. And by the age of 80, still under 1% risk of heart attack and stroke. So the sooner in your life that you get your LDL down, the better you're going to be. You want to avoid cumulative exposure over your lifetime of a high LDL cholesterol number. And don't let anybody tell you that LDL doesn't matter. This is a consensus statement from the European Society of Cardiology, which goes through all the science saying straight out LDL cholesterol causes heart disease and stroke. They go through all the different lines of possible evidence in order to make that determination. The plausibility of the evidence, the strength, the biologic gradient, temporal sequence, specificity, consistency, coherency of the data. And then if you intervene and lower the numbers, what's the risk? And all of these had the highest level of evidence grade, making it absolutely convincing. LDL cholesterol, if it's high, clogs your arteries and increases your heart disease risk and your stroke risk. So what are optimal LDL cholesterol numbers? Well, more and more evidence is really showing we should have it between 50 and 70 milligrams per deciliter. When you look at healthy babies and primates out in nature, they're somewhere between 30 and 80 on their LDL cholesterol numbers. And if you check out this study, which is a graph of a bunch of different clinical trials of primary prevention, each dot represents thousands of patients. The LDL cholesterol where the risk of heart attack goes down close to zero, 55. So what does the ketogenic diet do to your LDL cholesterol number? Well, check out this study from the Mayo Clinic where they took a bunch of people, put them on the ketogenic diet and looked at what's called the hyper-responders. About a third of people are hyper-responders. In this study, their LDL started at 125 and went to over 300. Now, when they got off the ketogenic diet, their LDL came straight down. Some of them were actually put on medications because their number went so high on their LDL cholesterol. Let's shift away from cholesterol and talk about the inflammation and damage to the artery lining. Animal-based foods versus plant-based foods. How do they play out? Well, again, ketogenic diet is very animal heavy, animal protein heavy. And when we look at what animal proteins do to inflammation in your artery health, TMAO, trimethylamine oxide, heterocyclic means, heme iron, Nu5G, advanced glycylation end products, and endotoxins are all produced when you consume animal-based proteins, and all of those things in different ways damage the artery lining and cause inflammation. But when you get plant-based sources of protein, you've got fiber, vitamin C, and lots of different phytonutrients which are anti-inflammatory and help the health of your artery lining, lowering your risk of heart disease. How does this play out in clinical studies? Well, check out these publications from the Journal of the American Medical Association, 3 of them, which all looked at the same thing. Animal-based proteins versus plant-based proteins. Does it cause heart attacks? Does it cause strokes? Does it cause cancer? And your overall mortality rate. What we find is replacement of only 3% of energy from animal protein and giving plant protein instead significantly lowered mortality, especially cardiovascular heart disease mortality. The lower overall mortality was actually a lot of it attributed to egg protein and red meat protein. But as we'll see, it's actually all types of animal-based proteins. So let's look at this graph from this study here. And let's see removing which animal-based proteins and substituting a plant-based proteins has the most dramatic reduction in overall risk of dying. This line right here is where it would be neutral. Anything to the left of this line lowers the risk of dying and would favor the plant-based protein source, eating beans and lentils instead of the specific animal-based protein source. So processed red meat was the absolute worst. Don't eat your hot dogs, man. And then unprocessed red meat was still quite significant. That if you removed the unprocessed red meat and instead had plant-based proteins, your mortality went down significantly. But there was even a mortality benefit of removing poultry and removing fish, and a very significant one for removing egg-based protein and dairy-based protein. So again, it's not just the cholesterol and the saturated fat, it's actually the animal-based protein as well, causing inflammation and damage to the artery lining, leading to clogging of arteries, heart attack, stroke, and overall death. But Dr. Loam, on a ketogenic diet, you can lose a ton of weight. Well, of course you can lose a ton of weight. Look what Americans eat. They eat 63% of their calories from processed foods. So anything that gets rid of sugar and refined carbohydrates, you're going to lose a lot of weight on it, right? So it's not necessarily the weight loss that's important. You want to be healthy in the long term. You want to live a long, good life without heart attack, without stroke, without cancer. And you can lose weight doing other things that aren't healthy for you, right? What if we gave you chemotherapy? You're going to throw up. You're not going to be able to eat. You're going to feel miserable. You're going to lose weight. Does that mean chemotherapy is good for you in the long term? Absolutely not. Same thing with becoming a cocaine addict. You can lose a lot of weight if all you did was cocaine and drugs. Is that going to be good for you in the long term in regards to your health? No, it's just like a ketogenic diet. Just because it can make you lose weight doesn't mean it's good for you in the long term. Now let's look at some data in regards to what low carbohydrate ketogenic type diets do to your overall health. Low carbohydrate diets in this study were associated with significantly higher risk of all-cause mortality. And in this study, low carbohydrate dietary patterns favoring animal-based protein as fat sources such as lamb, beef, pork, chicken were associated again with a much higher mortality. Whereas if you had plant-based protein and plant-based fats such as from vegetables, nuts, peanut butter, whole grains, you had a much lower mortality. Now, how about in patients who have heart disease? That's my area. I'm a cardiologist. Well, if you have heart disease, this study showed a 53% increase in all-cause mortality if you had a low carbohydrate diet that was high in animal-based proteins. And yet another study showing that switching to the ketogenic diet is associated with increased cholesterol numbers and increased inflammation markers, like we just said, we don't want. This is why the guidelines from the American College of Cardiology and the American Heart Association for Prevention of Heart Disease show that a plant-based diet is ideal for overall heart health. Come on, Dr. Loam, the caveman used to eat this way, right? Well, no, actually they didn't, but even if they did, do you really want to live to be only 35 years old? That was the life expectancy of the caveman. So what should we do? Well, data from Dean Ornish. Here's his lifestyle heart trial published in 1990, which showed that if you took people who had clogged arteries of greater than 50% or more, that the average percentage stenosis blockage regressed, went down if you followed a whole food, plant-based, low-fat diet versus a control group which actually progressed and worsened their heart disease. So comprehensive lifestyle changes, including a whole food, plant-based, low-fat diet, can actually regress and reverse heart disease in just 1 year without the use of medications. So then why then do so many people advocate a ketogenic type diet? There's lots of doctors out there that are saying that you should do this. It's all about the money. People love to hear good news about their bad habits. You can lose weight this way, but it's not good for you in the long term. And these authors, these people, they sell books, they sell supplements to correct the nutritional deficiencies that their diet causes. And one of the greatest historical examples of that is Dr. Atkins and the Atkins diet, who sold millions and millions and millions of books and made millions more money just selling the supplements that he needed to give his patients to correct the nutritional deficiencies that his diet caused. Check out this clip from a debate between Dr. Atkins and Dr. Dean Ornish that was actually held by the USDA in regards to what we should be eating to lower overall heart disease risk. This is quite embarrassing for Dr. Atkins.
I sort of resent the idea that people are saying that my diet is not heart healthy. If it were not heart healthy, we wouldn't be reversing heart disease and getting these people who were having chest pain on a little bit of exertion out there running and jogging a few months later.
This brings me to Dr. Ornish to follow up on it.
First of all, let me say that I would love to see some data from Dr. Atkins showing that he can actually get reversal of heart disease, measuring the underlying disease process.
We're working on it.
Well, good. I'd
But
love to see it.
we're not as good a fundraiser as you are. We have to dig into our own pockets. That's the problem.
I'm sorry. Carolyn, can I address that issue?
I think with the number of books you've sold, you could probably fund your own studies. Most people, unfortunately, when they think about the diet I recommend, think about the reversal diet. And it is a strict diet, and I'd love to be able to tell people that more moderate changes can reverse heart disease, but they don't. Every study that's been done where they've looked at arteriography has found that a 30% fat diet, the majority of people continue to get worse. But there is a genetic variability in how efficiently your body can handle fat and cholesterol. What I tell people is that if your cholesterol level is below 150 consistently, then either you're not eating much fat and cholesterol or your body's very good at getting rid of it. Either way, your risk of disease is so low, whatever you're doing is probably fine.
Thank you.
Most people don't fall into that category. And
You wanted to make a comment, Dr. Ayub?
Just because it was brought out about Dr. Atkins' claim to reverse heart disease. And he said he's working on the data, but he's been making this claim for a long time.
No, I haven't.
And that's what excuse me.
But I haven't
Excuse
been
me.
making that claim.
You just did, and you don't have the evidence to back it up. Now, this diet's been out there for 30 years, or close to 30
And I haven't
years.
been able to fund a study. I've asked
Excuse me.
and asked
Excuse
and
me. 10 million books in print, and you can't fund the study?
Now I can. And I will be the first doctor to dig into his own pocket to do a study. And it will be me, but it was the first time I had
10 million books. You market the vitamins. You sell the vitamins
Now.
to correct the nutritional deficiencies.
That's true. That's why
and
I'm
you
doing
market
a study
them.
now.
I keep saying
That's why I couldn't do it before.
you market this. I say this is not for the public good. This is marketed. This is a money-making proposition.
Dr. Atkins himself ended up having a heart attack, heart failure, and hypertension when his records were accidentally released. And when he passed away, he was 258 pounds. Clearly, his diet wasn't working for his own individual health. So what does work for long-term weight loss and long-term health? Well, check out this study, the BROAD trial, which put people on a whole food, plant-based, low-fat diet, and you had huge improvements in the BMI, cholesterol, and other risk factors. To the best of the researchers' knowledge, this program achieved more weight loss at 6 and 12 months than any other clinical trial has ever shown without limiting calories and without mandating any exercise. A whole food, plant-based, low-fat diet. And this is what the blue zones eat, right? They're a very high carbohydrate diet, but their carbohydrates are coming from fruits and vegetables, beans and lentils, whole grains, nuts and seeds. They were much lower in fat percentage of calories, 20% versus ketogenic, which is 70% or so. And they were lower in proteins, about 15% of calories from proteins. Now, the longest living culture, which is similar to the Ornish diet, was the Okinawans. They were 85% carbohydrates, 6% fat, and 9% protein. So a very low protein diet, a very high carbohydrate diet, and this is what you do for heart disease reversal. Very similar. And those Okinawans, arguably the longest living culture ever described. So what should we do? How do we think about nutrition then? Well, we have three categories of food. We have processed foods, which include all the junk that's obvious, the refined carbohydrates like white flour, white sugar, and added oils and fats. Then the second category of food we have are the animal-based foods, the high-fat ones, the low-fat ones, any of them, meat, eggs, dairy, seafood, cheese. And then we have whole, unprocessed, plant-based foods. What we want to do is remove the processed foods completely and dramatically reduce or eliminate the animal-based foods and focus on a predominantly whole food, plant-based diet. There should really just be one category of food. So avoid the ketogenic diet at all costs. Now, maybe if you were to do a ketogenic diet in a more plant-based fashion, a plant-based keto diet, perhaps it would be better if your cholesterol numbers are down and it's not causing you some inflammation. That might be better, but even with that, there's not a lot of long-term studies to say that that is what you should be doing either. So just stick to a whole food, plant-based, low-fat diet. It's going to help you lose weight, it's going to give you more energy, and it's going to make you live long and live better. So for those of you that want to learn more about weight loss, check out my weight loss video and my discussion panel video that we did at the International Conference on Nutrition and Medicine, where weight loss experts, including myself, talked all about diet, drugs, surgery, and a lifestyle medicine approach to our weight loss epidemic. So keto kills you. Don't try it. Eat your plants.